Hi, everybody. This is Becky Cole. I am the U.S. representative for the ErgoFinger, and today I wanted to interview Erin. She's going to tell us a little bit about herself and her experience with the ErgoFinger. So, Erin, I'm going to turn it over to you, and you tell us a little bit about yourself.
Oh, great, Becky. My name is Erin, and I am in a general practice setting here in Lincoln, Nebraska. And I have been a hygienist in the clinical setting for 26 years. So I've been at this for a while. I'm not sure what other information you want to know about me, but when it comes to clinical practice, I've been cleaning teeth for a while now and had a lot of interaction with a lot of patients from all age groups, from probably 2 years old all the way up to I think my oldest patient was probably 101. So
Awesome. Okay. We're just going to ask Erin some questions about the ErgoFinger and her experience that she's had with it. And the first question, I just kind of want to know, what was it that intrigued you about the ErgoFinger? What was it that made you decide that this was the product for you?
Well, that's interesting. I saw that, I think it was you, Becky, that posted a video or shared it in a group on social media. I'm not exactly sure where, but it intrigued me, the video, because it was a HVE that was being held on a finger, and it was, different than all the other things that were flying out of the market at that time. And so I started watching the videos and just keeping track of the things you were sharing. And that's what intrigued me the most, is that it was different. And I'm okay with different if it works, right? After 26 years, you try a lot of things, and some things don't work out so well, and some things work great. I think that's just how it works when you've been in practice that long. You kind of start to see those trends. But so I think I saw that video, gosh, probably back in June of last summer. And I just kept waiting and waiting for it to come on the market in the United States, and convinced my employer to order it. So that's kind of how it started.
So you ordered it shortly after we put it on the market. So how long have you been using it then in your practice now?
Well, I'm trying to think that when it finally arrived at our office, because we did have to wait a bit. Was that July that it was finally shipped? I don't know. It was like one of the first shipments. So I've been using it since July, since it first arrived, and it did take me a little time to get used to it. I will say that, but I was pretty proactive in the fact that I took one home and practiced.
That does help for sure.
Yeah, I mean, I just got out my Typodont from school and just kind of, had to work with it and figure out how it fit best, and just, I did that for a good few days over a weekend, and that helped me get off running with that piece of equipment. But so yeah, it'll be coming up on a year this summer that I've been using it.
So with the ErgoFinger, with practicing it, what were some of the features that you liked best about the product?
Well, I liked the idea of not having to hold it in my hand, like, for example, like a traditional suction that, is designed for a dental assistant, I guess, because that was causing me wrist pain in my wrist. And so I was even avoiding using, the recommendation was to avoid any aerosol producing procedures anyway. So I was avoiding as much of that as I could. But if I felt like I needed to use the ultrasonic, or that's what we have in our practice, is an ultrasonic, I did not want to, because I could not hold that hose. I could not hold that traditional HV, because it was just really it's starting to cause wrist pain, shoulder pain, because I started, doing the whole chicken arm thing. And so I was more intrigued with how could I get rid of this pain that I was experiencing. And so I was looking forward to, what is the hose going to be like? How heavy is it going to be? How long will it be? Yes, the finger, the wearable part, was intriguing to me, because I wondered if I was going to have more control over it, which right away I learned that I do have more control. So those are the things that really sparked my interest the most. And I can honestly say that after using it for this long, I don't have any shoulder pain in my left shoulder, and the wrist pain is gone. So I think that it's important that we listen to our bodies in this profession. If we don't listen, then we can become really injured in a bad way that probably would remove us from clinical practice. So it's important to listen to those cues.
Yeah, I agree with that for sure. So when you started using it on your patients, what was their response? What was their initial response when you started using it with them? Did they notice the difference in the product or notice that, the water control was better?
I don't think that patients really noticed a difference right off the bat, unless I mentioned it, that I was using something different. And I did that at first because I was still a little clumsy. I had to say, well, I might be suctioning up your lip or your tongue. I'm getting better at this, but just be patient with me. And most of them were pretty receptive to it, and they liked the idea, and they started to understand that I was really trying to control aerosols and engaging patients in the conversation of why we're changing equipment and the reasons that we're doing the things that we're doing. They started to really appreciate it. For one, they want to be safe. Most of the patients that I work with don't want people to be sick. So they were working hard, themselves to, maintain distance and keep people in our community safe. So they appreciated what we were doing. And that was the biggest thing that they noticed. Now, as time has gone on, patients have indicated to me that they like it because they don't feel like they're getting a lot of water in the back of their mouth. And I still have patients that want to close down on it, which doesn't go so well, but they're getting better about not doing that. But I think my older patients, I should say, my more geriatric patients, I like using it because I know that they're not going to have that risk of aspiration either, because that's a higher risk as individuals, get older. And I do have quite a few patients that are in their 80s and 90s, and they're finally starting to come in. It's been a year, but they're finally be able to leave their assisted living or their nursing home setting and come in for treatment. So it's been challenging because they've been without care from us for a year. And so I feel like this is a safe alternative to keep them from aspirating anything. Yeah. So I use it with polishing. I use it not only if I'm using the ultrasonic, but I'm using it the whole time.
Yeah. I don't even use my saliva ejector anymore.
Hardly at all.
Yep.
Nope.
So if you could recommend this product for different colleagues, what would be some of the highlights that you would say why they should pick this product? Or if they have hesitation about trying it, what would you say to them?
I would say to them to be open to change. It allows me to move around the chair. So I'm not only working in the positions that I was working at before, but I'm able to actually swing over to the other side of the chair, which I wasn't able to do because I didn't have that long of a hose. Now I have a longer hose and it's lightweight. It's not like I'm dragging around, a big heavy piece of equipment around the chair with me. It's easy to switch from your index finger to your middle finger. So that way then I am now able to confidently hold the mirror, but I found that I really don't need to hold the mirror if I'm able to move around the chair. Yep. So I'm finding I can use direct vision, which gets me in a better ergonomic position anyway, which is, again, alleviating any neck or back pain. It's actually equalizing what I'm doing with the left and right side of my body. And in my last health journey this last year, I had something that affected the left side of my body. And in that journey, the physical therapist that I work with taught me a lot about the faults of our profession is that we are very right-hand dominant. Right. Even if I would be I'm not a left-handed provider, like professional. I'm right-handed, but everything we do is geared to the right side of our body. So that caused an imbalance. Then my health situation, probably made it even worse. So by using this equipment, I'm actually equaling out. So I'm more like a well-balanced car in a way. I mean, that's how she described it. We want to keep you in balance so that way you're not just right side dominant. We've got to use the left side too. So that's what I usually tell my colleagues. This doesn't keep you stagnant on one side of the chair. You can move all around. I'm able to stand. because the hose is long enough, I can raise the chair up. It's really been great for me to have something that's wearable on my hand, and I can use my hand in other ways, not just for the suction.
So as far as like aerosol control, what do you think is the most powerful about the tool?
I'm sorry, Becky, can you repeat your question because you kind of froze on my end?
As far as aerosol control, what do you think is the benefit of the ErgoFinger and how that works as far as managing that aerosol?
I really I can see the aerosol control works really well because my patient's face is not getting wet. Mm-hmm. And I can hold that ErgoFinger within a few centimeters of my ultrasonic. Yeah. And that is so much better than something that's held farther away. You're still going to get the aerosol outside of the mouth if you're that far away from the working tip of the ultrasonic. Same thing with the polisher. It reduces the splatter as well. So I'm not fortunate to have an air polisher in my practice, but I would imagine it's the same with an air polisher, that you're not going to get.
Yeah, it's been great. Well, I appreciate getting to talk to you. We live actually only 45 minutes from each other, and so we were just saying how it's been to have a colleague that's so close that has been using the product, and we've kind of talked back and forth just a little bit about it. So I really appreciate you taking the time today to talk to us about the ErgoFinger and just help give confidence to those that are just deciding whether or not the ErgoFinger is the right thing for them or not. And so we really appreciate you spending the time with us today and telling us a little bit about your experience.
Yeah, it's been a pleasure. Thank you for the great, I guess, engineering and design, because it really works well for me.
Yeah, the girls in Finland, I'm so proud of their accomplishment. So they've done an amazing thing, and I've got to be a part of it. So, all right, thank you so much. We hope you have a wonderful day.
Yeah, you're welcome, Becky.